Hello, my name is Dr. Dafiola Belierai. I'm orthodontic resident at Roseman University of Health Science, class of 2024.
My name is Dr. Mehtab Warya. I'm also at the Roseman University and class of 2024.
Our research topic is orthodontic treatment modalities. Do the finished smile differ? This is an ongoing survey study. Our principal investigator is Dr. Kimberly Jones-Rudolph. Our study is focused on different treatment modalities for teeth alignment, which include Invisalign, traditional braces, in-house aligner, do-it-yourself, and even teleorthodontic approaches such as Candid and Smile Direct. This research will explore whether orthodontists can identify which treatment modality was used to treat each case based solely on the initial and final photos of smile and frontal occlusion. Orthodontists will be provided with photos of cases treated using different orthodontic approaches, and they will be asked to identify which specific treatment modality they think was used to treat the case, and they will also be asked to rate the aesthetic outcome of the case. Rather than typical factors such as molar relationship and cephalometric measurement used to evaluate a treatment outcome, other aesthetic factors will be the main focus, such as a midline, gingival height, buccal corridor, smile arch, and alignment. Orthodontists will be evaluating the case outcomes and they will come with the best guess of which treatment was performed in each of the patients. Typically, these are the primary views that the patient will evaluate as well, their smile in the pictures and what their teeth look like when they bite together in front of the mirror. Patients are thought to evaluate the success of the treatment by primarily aesthetic indicators, and that's why our research is limiting the orthodontist to the specific aesthetic indicators to make the evaluation for each of the cases more similar to what the patient may assess as well. The purpose of this study is to evaluate the level of accuracy of orthodontists and determining the treatment mechanism used to treat a case by examining only smile aesthetic and frontal occlusal photos. There have been studies that looked at the aesthetic indicator and how they impact to both orthodontist and layperson assessments of the case. However, this study is unique in that it wants to explore orthodontist bias against certain treatment mechanism and how that bias may impact their accuracy in assessing treatment mechanisms. The objectives of this study are, first, to evaluate the level of accuracy of orthodontists and determining the treatment mechanism used to treat a case by examining only smile aesthetic and frontal occlusal photos. Second, to determine if orthodontists are biased in their choices of treatment modality based on the aesthetic score they apply to the outcome. And third, to determine whether their bias may impact their accuracy in assessing treatment mechanisms given photos of smile aesthetic and frontal occlusal outcome. Dr. Warya will continue with materials and methods.
This research utilizes a cross-sectional study, which will be assessed by use of a survey. The survey will consist of 2 main questions across multiple outcome photographs and 10 additional demographic and treatment preference questions. The survey will be distributed online to 4,400 orthodontists through the AAO, and there will be a compilation of smile and frontal occlusal photos, 1 frontal occlusion and 1 smile for each case, with 2 accompanying questions for each. 1 question will ask the orthodontist to rate the photographs aesthetically based on the smile and occlusion, and the other question will ask them to identify the treatment mechanism provided. The photo combination will consist of 20 finished cases that have already been treated with different orthodontic treatment mechanisms, including Invisalign, traditional braces, in-house aligners, and teleorthodontic approaches. The cases will then be divided into 4 groups consisting of 5 subjects for each orthodontic treatment approach from a sample size of 20 subjects. And for the inclusion/exclusion criteria, first is that the subject's age will be at least 15 years or older. There will be no retreatment cases. It will be class 1 malocclusions with crowdings of 4 to 6 millimeter per arch. The depth of bite will not exceed 50%, and open bites will be no greater than 2 millimeters. Dental midlines will also not be greater than 2 millimeters. There will be no supernumerary, misshapen, or missing teeth. There will be no obvious facial asymmetry or canted occlusion. The patient should have before and after treatment photographic records, and there will be no extraction cases. And for the data analysis and results, the variables in this study include gender, age range, most preferred method to address each case, reason for the preferred method, and least preferred method to address each case. Our null hypothesis is that when evaluating the outcome of a case based solely on the smile and frontal occlusion, orthodontists will not be able to accurately determine the treatment mechanism used. However, their biases with regards to which treatment they believe to be most effective and capable of creating the best outcome will become obvious based on how they evaluate the aesthetic result. Thank you so much for listening.
Thank you.